every parent wants their kid to have a bright future, to be independent. Like, God forbid, one of my first thoughts was, God forbid, should something happen to myself, then what is going to happen to my son? I need to, because nobody really wants a very high maintenance kid. I mean, of course, we had family, right? We had guardians, but nobody really understands a really high maintenance kid on the spectrum. And we had no idea what would happen. So that was my driving force behind everything that I've been through. For me, it was, for my son, it was like between 7.5 to 8.5 years of little by little research, which I did, step by step to find out.
Welcome to the BioNexus Health Podcast with Dr. Jodie Dashore, a master herbalist, an internationally recognized pioneering clinician, and author. Her naturopathic journey began when her autistic son developed a series of traumatic, life-threatening chronic health issues. She honed her skills to combine the ancient Ayurvedic healing practices with Western herbal medicine that has helped patients in over 50 countries and recovered her son from the spectrum to the honor roll. And now here's your host of BioNexus Health Podcast, Dr. Jodie Dashore.
What is autism? Autism is you don't have to be so fast in giving the diagnosis just because there are some symptoms, because those symptoms, studies, a lot of research studies have shown that brain inflammation, brain damage, certain nuclei in the gray matter can be damaged with infections, exposure to biological toxins. I talk about this in many of my YouTube lectures as well. And exposure to environmental toxins, like water seepage and mold. And this can create an effect of autism spectrum disorder. This can give you sensory issues. Then, unfortunately, if there are infections, those can cause pain and discomfort and sleep problems. And, many of these infections cross the blood-brain barrier. So they are in the brain, and these things could be the things that is causing problems with sleep, that's causing problems with leaky gut. And unfortunately, all over the world, all of these symptoms are swept under the same umbrella. Oh, it's autism. So, they cry. And because they are nonverbal, they can't really say that, Mom, my stomach hurts. I have a headache. My head is hurting. When my son, I'm going to cry because it's just, when my son had started to use words and explain, he would just go like, Mama, ouchie, and I'm like, why are you, in the beginning, you're like, okay, why are you shaking your head? Can you stop that? What's going on? Why do you keep falling? What's wrong? Why are you not being careful? Then you slowly understand that Lyme disease, for example, one of the infections, it attacks the cranial nerves. So that is why his vision is affected. He's not trying to be trouble. He's not trying to create trouble. He's not trying to give you a hard time. So all of these things are unfortunately poorly understood, that, something like this could be happening, that it could not be real autism.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.